The state doesn't have a say in how these programs are implemented. We simply reimburse. So I think we're making the case, and what the leader's talking about is, if we are too prescriptive and those legislators don't, or those counties don't feel like they have the ability to find those savings, we need to give them the tools to find that savings. If they can, that's where we get the reduction in costs.
Why will we not let the cost copies in?
I'm not certain of managing.
Governor, what happened to your sales tax proposal?
It was compromised out.
Sorry,
It was compromised out. Bonding is still being worked. The bonding piece on this is that usually comes afterwards. Bonding is able to come after we're able to get this piece of it. Those things will come at reimbursed. So I think we're making the case, and what the leader's talking about is, if we are too prescriptive and those legislators don't, or those counties don't feel like they have the ability to find those savings, we need to give them the tools to find that savings. If they can, that's where we get the reduction in costs.
Why would we not let the cost copies in?
I'm not certain of managing this.
What happened to your sales tax proposal in this?
It was compromised out. It was compromised out. So
But is there bonding agreement on a bonding bill?
bonding is still being worked. The bonding piece on this is that usually comes afterwards. Bonding is able to come after we're able to get this piece of it.
So is that what there would be money for, say, Excel or the Vikings team? Is there money in this deal for them?
Those things will come at, if there's bonding, there is no money at this time in either of those, because I think the compromise piece to get there was, we can only take so many issues, I think. I can't hear.
If I can just step in on bonding one more time, we know that needs across the state of Minnesota matter very much as far as our roads, bridges, wastewater, the things that we have to look at. And so we came up with a conservative number, but one that will allow us to get the work done. We're looking at about a $700 million effect on bonding. Our chairs, both House and Senate, have been meeting regularly. They've done tours around the state, and they are listening to our communities to develop and determine what we will be able to do. That work hasn't quite been finished yet, but we're working very hard on the bonding issue.
Well, it says we got a lot of work to do. This is what happens. We knew that you heard this in here, the passion on this, and I'm pretty certain this is around the health care issue. And I'm not going to sugarcoat how difficult this was. And these lawmakers are there. They have their voice heard. We'll vote on this. We didn't expect everybody to be happy in this. I think many of us compromised. I think Leader Dameth is going to hear some of the same, and that we compromise. So, yeah.
Our caucus is full of immigrants and children of immigrants, and this is a deeply personal issue. They know people who are receiving medical care whose lives were saved because of access to Minnesota care for undocumented immigrants starting on January 1st, and they know that these individuals' lives are threatened by the removal of that health care. And it is personal, and it is visceral, and it is warranted.
You know, we have a job to do. The 34 of us and the 67 members in the Senate have the job to be able to move this budget through the chambers and to get it onto the governor's desk for signature. But it is the case, as I have been talking with my colleagues, that this is a very visceral and painful issue. I'm not at all surprised. That this is the response, and I would expect that this is going to be the case across Minnesota. Now, they're human beings. They are Minnesotans. They work in our communities. They work with and alongside us. They go to church with us. They are our neighbors. And we have made a decision in a compromise that suggests that they are other. And that is something that people are going to object to.
There was no conversations at that time about Medicaid at the federal level being cut.
Yeah.
Was that part of some of the compromises that were made on Minnesota care for immigrants?
No, the question is good, and look,
the address, the passions, you hear them, decisions that have to be made of funding all of state government. This issue was a linchpin issue of whether we were able to get anything done and shut down government or not. So I hear the passion. On the issue of Medicaid, that's exactly right. The cuts at the federal level, specifically dealing with Medicaid, should the budget that looks like the House is going to pass go forward, we will be back here almost without doubt to have to relook at our budget because of the impact that those cuts will make. We made the decision amongst leaders is we are in our lane with our budget, managing what we manage based on our revenues and our expenditures and balancing out for those out years. The federal government is, the 800-pound gorilla in the room. If they make these decisions on healthcare, on transportation, and on other things, it will impact us in a profound way.